Hi, I'm Bryn with the Career Podcast, and today I am here with
Barbra Lonsky.
awesome. Can you describe yourself in 3 to 5 words on who you were as a high school student?
Well, I was kind of conflicted.
Okay.
We moved from New York to Texas when I was a teenager going into high school.
Okay.
And so it was difficult.
Mhm.
Um, and I was interested in a lot of different things, very, inquisitive.
Mhm.
And I think another way to describe it, I've always had a compassion for people.
Okay.
It's always been my heart to help people.
Yeah. I mean, with the musicals and stuff here.
Yeah.
Yeah. Okay. Can you share a little bit about your professional journey?
It was actually quite interesting. I graduated high school not knowing what I wanted to do. My home life was not the best, and so I ended up leaving home and ended up in New Orleans
Oh.
and with some friends, and then my friends decided to go back to Texas and left me.
Oh.
And so it was kind of a rough situation there for a bit. But a man in the apartment complex that I lived in was a respiratory therapist.
Oh.
And he said, if you want to come to work for me, I'll train you. And this was back at the very beginning of respiratory care in the late 70s, early 80s.
Okay.
And he said, if you'll come to work for me, I'll train you in the profession.
Mm-hmm.
And now, of course, you have to have training school and licensures and stuff.
Yeah.
But he brought me on, and I became an on-the-job trainee in respiratory care.
Wow.
And we started out very rudimentary. Our equipment was very basic. We had to really cob a lot of things to put together to deal with our patients. Our technology was very, very basic and primitive. And we did, like, our sterilizations were done with gas sterilization, and everything had to be washed and wrapped and gassed. And so it was a lot of work starting out. And after I was in the profession for a year, I decided, well, I want to go to school.
Yeah.
So I started college in New Orleans.
Okay.
And went to school for a year there, injured my back, and ended up back in Texas. And then for the next 5 years, I finished my degree with life, jumping in between, had children and, all kinds of stuff. But, and then so I started working in a regional trauma unit in Texas.
Wow.
And worked as a neonatal intensive care therapist, also pediatric, adult trauma, cardio, just everything. And the stresses of that particular situation, I ended up moving to just an open heart surgery place and just, operated ventilators, worked codes, different things like that, which is, emergency resuscitations and stuff. And so it was very driven, very, and very diverse. Everything that you did was different. Every day there was something new and you were constantly learning. And I think that was one of the reasons why I was so attracted to the field.
Yeah.
Because it was just this intense learning experience every day.
Yeah.
Yeah. And so I continued on as respiratory therapist. I worked in home health care.
Mm-hmm.
I worked in hospital. I worked, different private situations, private care. And there's a lot of opportunities in the field to work different things. So So my career went on until about the early 2000s. I went to work in a small hospital in Portland.
Okay.
And worked as a therapist there part-time, and then it retired from there. But I had about 35 years in the profession before I retired.
Wow.
Yeah.
That's pretty crazy. So you mentioned you got education. Are there any certifications that you had to
Yes, I have an associate's in applied science,
Okay.
which is a medical associate's degree.
Mm-hmm.
And it was respiratory care was the focus.
Okay.
And of course, there's other applied science degrees. There's radiology and different things like that.
Yeah.
But because I worked in respiratory, that's where I got my degree. And then I went on, there is a national certification through the National Board of Respiratory Care. And I got my certification and then went on to get my registry, which is the highest level. And then you can get like other degree associations with it. Like you can become a pulmonary function person or like sleep studies or different things like that. There's a lot of asthma educator, different things.
Yeah.
And so I had the asthma educator, did that, did smoking cessation training, all that kind of stuff. But so it's really a lot of different ways that you can go with the degree. You can just do general, floor therapy, which is just giving breathing treatments and responding to resuscitation orders and codes and stuff. Mm-hmm. Or you can go into trauma, or you can go into a specialty like neonatal or pediatric. So it's really a lot of opportunity in the field.
Yeah.
Yeah.
What drew you to your specific, I want to say circle area?
I think for me, it was the fact that I needed a job
Yeah.
was a big part of it. But once I got into it, because I always kind of thought, well, I'd be really squeamish being around people who are sick or dying or whatever.
Yeah.
But actually, it drew me in to the point where became such a part of me to have that inquisitiveness and that desire to help.
Yeah.
And it just kind of brought me into that place. And so, I've worked in the medical profession. I've studied also, holistic medicine. I've studied herbal medicine and different things like that. So I have kind of a broad base of training, but
I see.
just interesting stuff,
That's super cool.
Yeah.
Would this be a nursing?
It is an applied science. It's an allied health, they call it. So nursing would be a specific degree, and you can have both. You can be a nurse and a respiratory therapist, but it does require that additional training and college education. Yeah.
I see. Okay. Okay. Would you describe what your day-to-day would look like?
Do you have about 6 minutes now? Just literally, that's
Yeah.
Well, normally you would start your day. You come in early for your shift. You would take report from the previous shift, which they give you information about the patients that they've dealt with through the night.
Okay.
Give you a tip up, about somebody who maybe is critical or starting to have problems, or people who are problematic just themselves. And so then you would go out, you take your rounds. You always carried a pager, so that if something happened, an emergency happened, you would have a pager.
Yeah. Okay.
They would assign usually two therapists to the code team for the day.
Gotcha.
So if there was an emergency, then they would have to respond to that emergency.
I see.
And then you just go out and start your day. You interact with patients, you interact with staff and physicians. Okay. Depending on where you are, like in the intensive care nursery, you would have to scrub. Surgically scrubbed to go into the nursery to work with the babies.
I see.
And so, there was a big diversity. And then, of course, you'd be doing your routine therapy. And then if you get an emergency call or a trauma call, you're called away from it.
Yep.
And so I think that was a part of the appeal to me, too, is that it was so just unpredictable. Yeah. It's like exciting. It was adrenaline, It's like, but then after a while, adrenaline kind of wears out. And because there is a high rate of burnout sometimes in that particular field because of the intensity of your day. If you have 2 or 3 codes or a mass trauma back to back, it really takes a toll on you physically.
I'm sure, yeah.
But so basically, that would be, it was interesting because I work nights sometimes, and anytime there was a full moon, you could expect that it was going to be absolutely bizarre.
Yeah, it's always a superstition, but that's the one I most believe in.
Yeah. Well, it's not even superstition because I've seen it happen. Exactly, just from the proof. They say, oh, full moon, and you end up with a lot of cardiac arrests, or you'd end up with people having babies. Yep. I think it's just the effect of the tides. We're all made of water, so it's like
everything's going to go down.
Yeah. And you have to learn how to interact with staff, like with physicians. Sometimes the physicians are difficult, and you have the hands-on with your patient, and so what they need. And oftentimes it's a job of convincing the physician of what the orders should be.
I see.
You have to diffuse difficult situations because people who are sick are not always in the best frame of mind. And they're not always nice, So, it's really an interesting way to develop those interpersonal skills and interactions too. So,
okay. Yeah. Okay. What equipment did you use from day to day?
It varied. Of course, working in critical care, you were responsible for the maintenance of the ventilators to keep people breathing. Monitoring systems, like oxygen monitoring systems, different things like that. Yeah. You used treatment equipment, different things like we would use a percussor to help loosen up secretions in a person's lungs. Okay. Or we'd use pressurized breathing, treatments, BiPAP, CPAP, all the different, medical devices that you use. And so we had to be trained in all of those. Okay. And it was usually done during like an in-service type training. And then you had to use math, obviously, to calculate volumes and to calculate rates and interpret blood gases, which is something that we also did. We had to learn how to draw blood from the artery and then process it. Yeah. So, which is a really interesting thing. It's a difficult blood draw because the artery doesn't like to be poked and it moves out of the way if you don't trim it in place, So we have a pretty, specifically based equipment that we use. But then Of course, working in a code situation, you kind of have to know everything
Yeah.
that's going on, like how to hook up suction,
Mhm.
how to hook up a chest tube, drainage,
Yeah.
and different things like that. So once you're in the field and you're actually working day to day in it,
Mhm.
it just becomes part of what you do every day.
Yeah. Okay.
Yeah.
So, you eventually just get desensitized to
Oh yeah,
a lot of the
yeah.
stuff.
And I think that's one of the good and bad things about the field.
Yeah.
Because sometimes you do tend to get to that point where you're so desensitized that the actual feelings that you have, you're suppressing to the point where you may deal with them in a bad way or inappropriate way.
Yeah.
When I worked evening shift, we used to go out after evening shift and spend the night out partying, which wasn't the most healthy way to deal with that stress. And I think, as I said, there is a high rate of burnout because of the intensity of the field.
Yeah.
But if you can learn how to cope with it in a
Mhm.
way that's healthy,
Yeah.
like exercise and
Mhm.
stepping away in the moment that you're working and doing a code or you're dealing with a patient who's critical,
Mhm.
you have to suppress those things.
Yes.
But when you step away from it, you need to take the time to
Mhm.
decompress
Yeah.
and talk about it.
Yeah.
My husband always laughs at me because I just love trauma. I
Yeah.
mean, it's just my thing.
Yeah.
Because that's what I've always done. And
Mhm.
he's like, I don't know how you can deal with it. And I said, well, it's just I want the answers, and so I continue to watch and to learn and to progress because I want to be able to help.
Even today.
Even
still.
today, yeah.
Yeah, that's
sure.
awesome. And you've been retired for how long now?
I've been retired for about 10 years.
Okay.
Yeah.
I see.
Yeah.
Still learning more every day.
Oh yeah, yeah. I love it's so interesting to me.
I see. Do you volunteer anywhere? Or like
At the moment, I don't.
Okay.
But I have in the past.
I see. Okay.
I worked with hospice some. I did some bereavement counseling and also interaction with patients and stuff
Yeah.
in hospice. But right now, I'm just kind of sticking by the.
Doing your thing.
Yeah.
I see. What are some good qualities that one would have to make it in this career field?
Okay. Well, I think first of all, compassion is a
Mhm.
huge part of it. You have to be able to identify with people's pain and be
Yes.
able to understand. Like a lot of times, you'll have difficult patients, but if you don't look at from the situation, they're hurting, they're afraid, they're worrying about whether they're going to be okay or not.
Yeah.
Then you have to deal with them with that compassion,
Mhm.
knowing that you could be in that same situation
Yeah.
or one of your family members.
Yeah.
Yeah.
I see.
And then stamina.
Yes. Yes.
Having, because you're on your feet,
Mhm.
you're running. Sometimes you run from the beginning of the shift to the end of the shift.
Yeah.
And then you have to stay after and chart. So, it just depending on how busy the shift is, you have to have some stamina.
Yeah.
And I think too that you have to be willing to learn,
Mhm.
because sometimes if you come into the situation thinking that you know everything,
Yep.
you can miss things that that are going on with a patient because you've already preconceived what the idea of what's wrong with them is,
Yeah.
and then find out that their symptoms, may be masking something else.
Yeah.
And so there have to be kind of an open-mindedness.
Okay.
And you have to have the ability to communicate.
Yeah. Problem solving.
Right. Yeah.
Like that.
Interpersonal skills are very important,
Yeah.
because it can be very tense when you're in there and you're trying to save somebody's life. And if you have a difference of opinion with somebody, you can't let that interfere with your care.
Yeah. I see.
Yeah.
You mentioned earlier getting help in a healthy way. Did your hospital provide opportunities for people to?
No.
No.
Well, the hospital that I worked at was a regional trauma unit,
Oh,
and so it was just you just did your work and you were out the door.
I see. Okay.
But I think that is something that is very valuable.
Mhm.
I know that when I was working with hospice, even I developed a program of relaxation, like listening to music, doing breathing, and helping to learn. Because for caregivers,
Yes.
because when you're a caregiver, you can burn out, and so I kind of learned to deal with my burnout situation with setting myself aside, doing deep breathing, thinking, praying, meditating,
Yeah.
different things that kind of just help to center me and get me back to, that level of where I'm not fight or flight all the time.
Yeah.
Because that's something that's very real.
Yeah.
When you respond in a situation, especially if you're conditioned to respond in that fight or flight,
Mhm.
it's the go-to.
Yeah.
And even now, I see things happen and immediately my mind goes into the worst case scenario thinking, this is what could be happening, and so it makes you very anxious.
Yeah.
And so you have to learn to deal with that aspect of it.
I see.
Yeah.
So, what do you find the most rewarding and then later challenging about this career field?
Well, I think the most rewarding thing is that you're helping people. Obviously when you have a patient that's gone through a really difficult situation and they come back
Yeah.
and they say thank you.
Yeah.
Because you saved their life.
Yeah.
I mean, it's a huge gratification in that respect. But I think too that part of that, it's kind of the other side of that, is that when you don't have a patient that survives, or if you lose somebody, or if something tragic happens, that it can be very, emotionally draining and upsetting.
Yeah.
And that's when you have to step back and say, okay, I did the best that I could, and always just do your best. And that's the way that you can walk away from it and know that, there was nothing that could be done. It was just their time. Yeah.
I see.
Yeah.
My last question for you is, do you have any outlets that are not necessarily academic that you use or used? It could be like books, videos off the internet, anything like that.
Well, I think one of the things when I was actually active in the profession, you have to do continuing education.
Yeah. Okay.
And so that can be done through either online classes, or it can be done through journals, like medical journals that are specifically for respiratory care, like the National Association of Respiratory Care produces a called the RT journal or the AARC journal.
I see.
And so that's something that you can do your continuing education that way.
Okay.
But honestly, the best way that, and I still do it now, my husband thinks I'm nuts, I watch YouTube videos about emergency room scenarios.
Yeah.
And I have learned so much about different situations and about diagnostics. And I think that that's a big part of working in the profession, is not just doing the superficial work, but understanding how that person got there and what you can do to reverse it, or what their potential issue might be that may not be obvious on the surface.
Yeah.
I had a patient that he was refusing treatments. Every time you would go in to do the treatment, he would refuse it. And there was a therapist that I worked with who was just he was there to work and that was it. And he said to me, he said, I can't get this guy to do his treatments. And I said, okay, I'll go talk to him. So I sat down with the man and I said, can I ask you, I said, is there a reason why you're refusing your treatments? And he said, my wife died a year ago here in this hospital. And he says, and I don't want to live. And I said, do you think your wife would want you to have that attitude about life? And he said, no. And I said, because I studied music therapy too. So it's like, I said to him, I says, is there any song that she particularly liked? And he said, In the Garden. And so I just said, well, I'll tell you what, I'll make a deal with you. I said, if you'll take your treatment, I'll sing In the Garden for you. And he said, okay. And so I sang and he took his treatment, and he kind of turned around after that and realized that his wife would have wanted him to live. And so I think, that looking at the underlying things instead of just looking at the surface and saying, oh, this patient's really irritable and nasty.
Yeah.
Well, what's the reason?
Yeah.
And that takes a little bit of time and compassion and inquiry to be able to say, okay, so you're refusing. Why are you refusing? And so, yeah, I think it's important to remember that we're people.
Yeah.
Yeah.
On either end.
Yeah.
I see. Is there anything else you'd like to add?
I would encourage young people to investigate the health professions, because they are very, very interesting. Yeah. It's a way that you can continually learn and grow and become a member of society that's functional and helpful. And I think that there's a lack in that area right now. Yeah. People are going into IT and different things like that, which is great.
Yes.
But we need those human services professions to be able to keep people moving.
Yeah, everyone needs it.
Yeah, exactly.
Awesome. Well, thank you for coming on here and telling us about your journey.
Yes.
This is it for the Career Conversations podcast.